Hello and welcome to today's short video webinar, How to Talk to Men About Suicide. I would like to quickly introduce our presenter, Dr. Graham Reynolds, who is a New York State licensed psychologist at the American Institute for Cognitive Therapy. He is also currently an adjunct professor and visiting scholar at Columbia University's Teaching College, where he instructs and supervises doctoral students in clinical psychology. He works with adults and adolescents who have anxiety, OCD, depression, and bipolar. Thank you so much for joining us today, Dr. Reynolds. I'm going to hand it off to you.
All right. Thank you, Sasha, for the introduction. Today, we're going to be talking about how to speak to men about suicide. My name is Graham Reynolds. I'm a clinical psychologist in New York at the American Institute for Cognitive Therapy. To start, I want to talk about some statistics. Suicide is among the leading causes of death in the United States. It is the 12th leading cause of death overall. For people aged 10 to 34, it is the second leading cause of death. And for people aged 35 to 54, it is the fourth leading cause of death. We've seen recent increases in people expressing thoughts of suicide, and according to the CDC, more than twice as many adults reported thoughts of suicide in 2020 compared to 2018. This is a really important issue, and that's why we wanted to highlight this here today. Rates for attempting suicide are higher among women, but completed attempts are higher for men. And therefore, it is especially important that we have conversations with men in our lives, whether they're our relatives, our friends, or our partners. Having these conversations can save lives. So let's talk about warning signs. There are some things that we want to be on the lookout for if there are certain behaviors occurring that might increase our level of concern. For instance, if the men in your life are talking about things like death or expressing feelings of hopelessness, if they're mentioning suicide specifically or talking about feelings of worthlessness. Other warning signs can include things like isolation, putting their affairs in order, even giving things away. If you see these warning signs, don't ignore them. Take note of them and use it as part of the conversation that you have when you express your concerns. Now, it's also important to address some myths about suicide. There is a belief that talking about suicide, even mentioning suicide, can increase the likelihood that you may somehow plant the idea in the person's head. This couldn't be further from the truth. Research shows that speaking to someone about suicide doesn't increase the likelihood that they're going to act on these thoughts. And as a matter of fact, it may be the thing that saves them. Therefore, it is so important that we have these talks. So, how do we begin a conversation with an important man in our lives about suicide? Well, first, we want to get ourselves comfortable. Having this conversation may not be easy. Sometimes our own discomfort with the content or what's about to be discussed can make us want to shy away or not speak up, not say things as directly as we might need to. Notice that, recognize that, and get yourself comfortable first, and then have the conversation. Remind yourself that you care about this person and you are strong enough to have this conversation with them. Now getting into what to say. First, let's talk about how you say it. You want to be attentive and calm. Perhaps you can describe some of the behaviors that you've been seeing in a non-judgmental way. For instance, I'm concerned about you and the things that you've been saying. You've been spending more time alone and you seem really isolated. Or you've been drinking more than you normally do, or using substances more than you normally do, and I have concerns about you. And finally, the ask. It is important here to be direct. This can be one of the most daunting aspects of speaking to men about suicide, but it is so important that we are direct, calm, and attentive. Ask them, have you been having thoughts about suicide? Have you been thinking about suicide recently? Are you thinking of suicide? It can be nerve-wracking to be so direct, but it's important to use the language and ask specifically, have you been thinking about suicide? No matter what the response, be supportive. It can be especially hard for men to talk about their feelings, sadness, depression, anxiety, anger, frustration, you name it. Whatever they respond with, validate, be compassionate, and say things like, I'm here when you need me. You've done a lot of hard things in your life, and I know you can do this too. Sometimes it seems like suicide is the way out, but it's not. And I'm confident that things can get better. Give the person some space if they need to process. But continue to demonstrate confidence and hope for the future, and that you are determined that you are going to do whatever you can do to help them to get better. A quick note on substances and other risk factors. A very large risk factor for suicide in men is substance use. Drugs and alcohol can increase impulsive behavior and lead to an impulsive decision when somebody is in a moment of weakness. If you're concerned about someone in your life, do what you can do to limit their access to drugs and alcohol. And especially if someone is seeking out lethal means completing suicide, see if you can get that person to agree to move things elsewhere, even temporarily. Reducing risk factors can help to save lives. Make sure to keep this up. This does not have to be a one-time conversation. As a matter of fact, it's best if it is made into an ongoing conversation. Risk can be lowered in one single conversation, but it can be further lowered in more conversations. So don't be afraid to continue having this talk. And finally, if you or someone you know is struggling or in crisis, help is available. You can call or text the 988 Suicide Crisis line at 988, available 24 hours a day, 7 days a week. Their lifeline provides confidential support to anyone in suicidal crisis or emotional distress. And for everyone who is watching this video, please do what you can do to help men who are struggling to get connected to a therapist or other mental health professional. Thank you.